Funding for this program was provided by the Annenberg CPB Project.
Sometimes, as we go through life, we master our experiences. Sometimes we don't.
I think there was a lot of things that put me in a category that I was a candidate for cancer. But I think that the emotional thing that I went through in this recent period of my life is what triggered the final onset of it.
When these things have happened, I can relate it back to stress that I've had, and you know, I've felt like I'm a tough guy sometimes. Well, stress doesn't bother me, but I can relate back to where there were stressful periods.
Even when the little kids were little, we had baptism party. He knew that a bunch of friends and family were coming over and people would be here. He'd get sick and have a headache.
People often do feel that their emotions can make them sick. How many times have we heard someone say they were sick with worry, that something upsetting was giving them a headache or an ulcer? Teenagers are warned that they are giving their parents heart attacks or strokes when they come in way past curfew. And what about that friend recently divorced who always seems to be sick? Or the widower who developed pneumonia soon after the funeral? Is it all a coincidence, bad timing, or is there more to it than that? Dr. Edward Katkin is a professor of psychology at the State University of New York at Stony Brook.
There's an enormous amount of active research going on the question of whether people's cognitive styles, their thought patterns, their emotional responses can contribute to illness. Then really, basically, the question is, can you talk yourself into a real illness? And everyone seems to think so. I mean, it's common folklore. Doctors tell their patients relax if they have high blood pressure, as if the high blood pressure was caused by the stress. Everyone believes in some way that our emotional lives contribute to illness.
And there was a transition leading up to a divorce. Obviously, there's the separation, and there's the anxiety of starting a new life, and did I make the right decision, and all of that. And I think that's when my immune system couldn't control it anymore. I really think that's when it got out of hand.
It's a good working hypothesis. There are good reasons to think it's possible, because we know there's very good scientific evidence that emotional stress causes clear and profound bodily changes in heart rate, changes in blood pressure, changes in hormone secretion rates, changes in a variety of subtle automatic bodily functions. And so, since we know that stress can do that to the body, it seems plausible to think that those body changes might contribute to disease. But that critical question about whether stress-induced bodily changes really do contribute to disease is not yet answerable. We really don't know.
What do we know? What role do psychological factors play in physical illness? In the next hour, we will explore this question by examining theories about causal factors in migraine headaches, cancer, and coronary heart disease, the #1 killer in the United States. Dr. Frank Pink is a 38-year-old dentist who lives with his wife and 3 children in a quiet neighborhood in Gainesville, Florida. He had always thought of himself as being pretty healthy, but 8 years ago he had a run-in with his heart, and last autumn it happened again. Only this time he landed up in the emergency room.
I was in the clinic here at the University of Florida with the students, and I was just walking around essentially, and I got a real crushing type of pain that I had to grab at my chest, and my left arm started to go numb a little, and pain went up into my left jaw. And so those were all the signs that I had learned from my education that meant that possibly a person could be having a heart attack. And so I went to the emergency room, and they They did an EKG there, which seemed to be normal, and then they gave me some nitroglycerin to see if that would help, and in fact it did make the pain feel better, and so that worried me then, because I thought, oh no, this is a heart attack type of circumstance. My grandmother on my father's side died of a heart attack when she was in her early 70s. And on my mother's side, her mother died when she was 49 of some cardiac problems, but at that point they weren't real sure what to tell her or tell my parents what she had died from. And then a few years ago when my mother was 58, she had a heart attack. She survived that heart attack, but it was young for her to have a heart attack.
Had the family genes caught up with him? Dr. Pink found his symptoms quite disturbing. Luckily for him, there was a preventive cardiology program at the University of Florida Medical Center. Dr. Marion Limacher, a cardiologist, is the director of the clinic.
There are a number of risk factors, and a risk factor is something that can be measured, something that can be assessed, and has been shown through a lot of scientific research and study to be associated or causative of the disease we're talking about. And in this case, we're talking about coronary heart disease. Blockages of the coronary arteries, the blood vessels that supply the heart. And there are certain things that you can't change. For example, one's age, one's gender, and one's family history are related to heart disease. The older you get, being male and having family members who've had heart disease puts you at risk. We can't do much about those. On the other hand, there are several modifiable risk factors. Those include having high blood pressure, high cholesterol, being a smoker, having a sedentary life, being overweight, and having a certain psychological profile seems to be a risk factor as well.
To assess Dr. Pink, they had to know more about him. Dr. Nancy Norville, a psychologist, was part of the team that evaluated Dr. Pink when he came to the preventive clinic.
Dr. Pink was someone who came to the hospital and came to the preventive cardiology clinic because he was concerned about his health. Had a family history of heart disease. He had been told by at least one physician that he might have mitral valve prolapse. And most importantly, he was experiencing chest pain, particularly under periods of stress at work. So when he came to the clinic, he really got a comprehensive evaluation. He got a medical workup, which is very important, so he understood the significance of his chest pain and that it wasn't a heart attack, that it wasn't a symptom of heart disease. And he also got assessed by an exercise physiologist, a dietitian, and a psychologist.
Dr. Pink's test results came out well.
Told me essentially is that the pains that I've had and that kind of clamping pressure and that they don't feel has been, or there hasn't been damage to my heart to this point. But if I felt those kind of pains, but they were a little bit different in character, that then I should go right to an emergency room because they don't want me to think that nothing's happening when in fact some things could be going on.
So according to Dr. Pink's doctors, he might still be at risk for heart disease. One factor was his family history. The second, according to Dr. Norville, was his psychological makeup.
He was very anxious at the time. He had a lot of stress, a lot of changes that happened in his life as he'd taken on a new job, moved himself and his family to a new city. So he, of course, could perceive himself as being under stress and having to make a lot of changes.
When these things have happened, I can relate it back to stress that I've had, and I've felt like I'm a tough guy sometimes. Well, stress doesn't bother me, but I can relate back to where there were stressful periods.
My doctor tells me I've got high blood pressure.
All the public service announcements warn us about the dangers to our hearts from high blood pressure, smoking, obesity, high cholesterol, and lack of exercise.
You can help prevent heart disease. We can tell you how.
One major factor is often overlooked: our psychological makeup. Could the way we interact with the world put us at as much risk for heart disease as a high cholesterol level?
One thing that in our psychological assessment of Dr. Pink that we saw was that on one measure he was showing some traits of what we call a type A behavior pattern.
The characteristics of the type A personality are excessive competitive drive in the absence of well-defined goals, impatience or time urgency, accelerated speech and motor activity, and hostility.
I think one of the most interesting aspects of the so-called type A personality or hostile personality and heart disease is that this is also not news. If you look back about 100 years ago, you can find one of the great physicians in history, Sir William Osler, in an essay talking about the hard-driving person who needs to take charge of his life, who's more likely to have a heart attack than the depressed or the weak or the anxious. And so even 100 years ago, physicians seemed to observe that there were certain kinds of aggressive, tough-minded, hard-driving, maybe nasty people who were predisposed to have heart disease.
What has happened through the years is that we've been trying to identify and understand what part of type A is really linked to heart disease. What is the critical component of type A? And probably the most important, if not the important factor there, is the hostility or anger component. That's a very important component now that we're focusing on. A person can be job involved, they can even have a sense of time urgency, but the free-floating and interpersonal hostility seems to be a very critical factor in understanding the link with heart disease.
After 30 years of research and many inconclusive studies, there continues to be heated debate over which components of the type A personality are most highly correlated with coronary heart disease. It must also be remembered that there are plenty of non-hostile people who get heart disease.
I think what we need to do is to zero in on all the possible causes of heart disease that arise from personality, and the only thing is that it isn't likely that just identifying a trait is going to tell you whether someone's going to be at higher risk. What you have to understand is how that trait interacts with a whole variety of social and environmental situations. And so what's really important is to understand what we like to call in psychology the person by situation interaction, so that it may very well be that hostile people who are in certain lifestyles are at no increased risk at all, while other hostile people in different life situations are at extremely high increased risk, because it's the hostility interacting with the lifestyle that can elicit the pathological changes in the physiology.
A self-confessed workaholic, Dr. Pink was constantly putting himself on deadlines. But overworking was only part of it. He was a perfectionist, very demanding of himself as well as of his colleagues and family. And he often got angry if things weren't just the way he wanted them to be.
I tend to like to have everything as perfect as it can be, and I will sometimes redo things that are probably fine, but I redo them just because I think they could be a little better.
Apple jelly.
He always expects the house to be, everything to be in its place, and the kids just can't live that way. They have to be kids, so we try and keep the house spotless, especially where he's going to be. But they like to play, and they like to pull their toys out and like to make a mess once in a while. So that's what we have to deal with on a daily basis, is trying to keep this house so that it's organized.
I tend to be impatient with myself as well as with other people, and that's probably what I think is the biggest flaw in my character. In fact, sometimes I'll be being impatient, and I tend to be more impatient with people that are closer to me. I haven't figured out the psychology of that yet, but I try, sometimes I'll be saying something or being impatient, and I'll think to myself, this isn't nice, I shouldn't be acting like this. But it's almost like a monster in me. I can't control it. It just sort of comes out.
Now, what are the things that are the hardest about him to live with?
He's too organized.
I hear everyone laughing about that. Now, do you think that he's too organized, Jennifer?
Yeah.
I'll explode almost. I have a temper then that sort of comes out, and sometimes it's occurred with students. I'll call them back into a back room and I'll say, what do you think you're doing? We've been over this before, and look at what you've done here, and now we're going to need to do this or that. Or at home, I'll get mad at one of the kids, and I'll say, how many times do I have to tell you? In fact, the other day it was eye-opening. My little boy said to me, I had done something, and I forget what it was, and he looked at me and he says, how many times do I have to tell you that? And I thought, that's me talking, that's me coming back to him.
Anyone can experience stress. But if we turn too many of life's normal events into stressful situations, our bodies can take a beating.
When we talk about how stress might be related to heart disease, one way to think about it is in a mechanical way. A person gets aroused, and we're talking about heart rate going up, we're talking about blood circulating through the body, we're talking about respiration and pulse increasing, and what happens is what's been termed a fight or flight response. The body is getting ready to fight and stand its ground or flee. And that can be very adaptive. But in stressful situations where that is being activated or that's happening, it can really create a wear and tear on the blood vessels. The resilience or how strong they can be is affected. The idea that you have your foot jammed all the way down to the ground with your accelerator and the other foot with the brake, and that really is going to be some wear and tear on the vessels.
So psychological factors might play a large role in Dr. Pink's heart symptoms. As a prudent man, he wants to do anything he can to reduce his risk. Stress management, for instance.
I think the first component of stress management is helping a person understand that they do have control over their environment. And while they may not be able to necessarily change the environment or the stressor itself, they certainly can make an impact on how they respond to the stressor and how they perceive the stressor.
Working to reduce Dr. Pink's hostility was another goal. Somewhat reluctantly, he took the stress management course that Dr. Norval had designed.
Well, at first, I probably had a bad attitude. I went into it thinking this isn't going to teach me anything that I need to know, or I'm not sure, why I should be here, but I'll give it a try because I'm concerned with what's happening. And so what we did, it was a 6-week course, and we'd meet about an hour and a half a week, and it was in a group. There were 3 other people in there. We would discuss things that were possibly stressful for the first few weeks and how we would handle those, what we did to try to handle them. And then we would review those with each other. We'd talk about them as a group and say, okay, this was a good thing to do, and maybe you could have done this to relieve your stress some. And pretty much take all situations and break them down into phases and see how you should handle it or how you should react, and control your reaction to different situations, and try to manage or control those things that you could control, and those that you can't, try to recognize that that was an uncontrollable situation. There wasn't anything you were going to be able to do about it.
One of the second things that I do, or right after they kind of understand the model and understand that they do have control, is teach people a skill where they can have some physiological control. I think a lot of times we're scared of our bodies and we feel like they respond without us having any control, when really we can have significant control of our physiological responses. One of the techniques that is used a lot in stress management is deep muscle relaxation. And there are different forms of this, but basically deep muscle relaxation is a series of exercises where the person learns how to tense and relax certain muscle groups. It's generally done with 16 muscle groups, and it's done in a 20 or 30 minute period. It's not just taking one deep breath and saying relax, but it's learning the difference between tension and relaxation.
I was sitting there and I was thinking to myself, boy, this is a bunch of hocus pocus, and I can't believe I'm sitting here, and it's where I could be home doing something, here instead of wasting my time with this. But I started to do it, and I did do it at home a few times and at work. And so now, when I know things are building up for that, I'll go into my office and I'll shut the door so nobody knows I'm there, essentially, and turn down the lights. And then I'll do that where I tense the different muscle and relax it, and work through my body that way. And it does work. I do feel better at the end of that, and I feel a little refreshed. It's not like I had taken a 4-hour nap or that, but I feel refreshed and a new outlook on things. I can walk out of my office and not be as tense or not be as tight as I was when I went in there.
Stress management is an excellent technique for helping people feel better, and I recommend it for those reasons. People who may be at high risk for heart disease are feeling tense. They're feeling pressured. They're feeling all the ways that type A people are supposed to feel. Not enough time in a day, too much pressure on them, competing, fighting, struggling. That's very uncomfortable. It feels bad. They should go into stress management to take care of those feelings. If a byproduct of that is that it reduces the risk for heart disease, that would be wonderful, but I don't think anyone can prove it.
Even though there's no proof that stress management will guarantee Dr. Pink a healthy future, he is convinced that it can make a difference. Among other things, he's trying not to be so hard on himself.
That was one thing that was important for Dr. Pink to make some changes in. is that he himself didn't have to be perfect and didn't have to expect other people to be perfect, that he didn't have to be working 12-hour days, that there was no must or should that associated with that. If he could drop back from that, take away that expectation that that was something he had to do or that he should do, he'd begin to relax a little bit, enjoy life, and start adding some components and some activities that he also enjoyed. Not that he didn't enjoy work, but that didn't have to be the sole part of his existence. He needed to kind of be a little less rigid and be able to incorporate more things and have a little bit more balanced life. For example, Dr. Pink really enjoys building models, and that's something he's been able to make time for because that's something that's relaxing for him and that helps him to manage his stress.
I've always loved airplanes since I was the littlest boy that I can remember, and my parents tell me that when I was 3 and 4 years old, I'd get airplane models even then, and I loved airplanes.
Dr. Pink bought his first radio-operated plane when he was in dental school. But as his life became hectic, he no longer made time for his favorite hobby. Now he does.
So now, every Sunday after church and Sunday school and that, I'll go out for a couple or 3 hours and fly, and then I work with the planes. At night, I try to spend an hour or so. And when I do that, I can get pretty engrossed in that, and I forget about everything else. So it's kind of neat therapy.
We all know what it's like to get headaches.
Sometimes stress headaches grab you. Pain feels like a rope around your skull. I go for Anderson. Always have.
But only some of us get migraines. Take Dylan Vargas. In many ways, he's a typical 13-year-old boy. When he's not playing video games with his brothers and sister, he's fighting with them. He loves sports.
I've been playing sports since I was in 2nd grade. I played soccer, football, basketball, boxing.
Dylan is a 7th grader studying World War II in his social studies class. He loves the fact that his father shares his passion for athletics, and he's awkward when asked about his girlfriend. Just an average teenager until we learn about his migraine headaches. His mother, Robin Vargas, talks about when the headaches started.
I almost don't remember him ever not having a headache. But I think he was probably around 3 or 4 when he started having them. First few times we had him, we rushed him to the hospital. He's kind of dark-complected. He'd get completely white. He'd cry and scream. He'd bang his head on the wall. Said it made him feel better. He'd get real cold. So we'd take him to the hospital. They could never figure out what was wrong with him at that age.
First I'd start to feel hot, and then after a while I'd get tired, and then I'd go upstairs and I'd lay down in the dark, and then sometimes I would hit my head, and pretty soon I'd fall asleep, and I'd wake up and throw up sometimes, and I'd eat.
As awful as these symptoms sound, they're quite typical of migraine headaches. The pain is usually on one side of the head, severe and throbbing. Exposure to loud noises and bright lights can be excruciating. They can last from minutes to days and be incapacitating. And for people like Dylan, who have classical migraines, the headaches are often preceded by auras, symptoms like seeing zigzag lines or flashing lights, tingling or numbness in an arm or leg, restlessness and confusion. These warning signals occur approximately 30 minutes before the onset of the migraine. As many as 20 million Americans get migraine headaches each year, with women outnumbering men 3 to 1. 5 to 7% of children and adolescents get them.
The actual mechanism of migraine is not very well understood, but it's not considered to be a muscle tension headache. It's primarily a disorder of the cerebral vasculature and has to do with uncontrollable constrictions and dilations of the blood vessels in the brain.
Even though the mechanism is not well understood, it seems to be a function of the sympathetic division of the autonomic nervous system. The sympathetic nervous system is our emergency preparedness division. It mobilizes us when we are in danger. Our heart rate increases, respiration accelerates, salivation and digestion are inhibited. This aroused state seems to trigger migraine headaches in some people.
And the reason we believe that is that one of the most effective medical treatments for the prevention of migraine is to give drugs which block the action of the sympathetic division of the nervous system. So a drug called propranolol, which is almost an automatic standard treatment for people with heart disease, because it prevents the heart from being overexcited, also has preventive effects on migraine sufferers. And that leads people to conclude that in some complex way, overexcitation of the sympathetic portion of the autonomic nervous system is a trigger for the migraine headache.
Other triggers are thought to include physical and emotional stress, changes in altitude or weather, poor sleeping habits, and hormonal changes in women. Certain foods have been implicated, such as red wine, aged cheeses, and chocolate. And for that reason, migraines have often been treated by avoiding certain foods and beverages. Other treatments for migraine fall into three categories: abortive, which is something done to end the headache after it has begun; prophylactic, in which something is done on a regular basis to prevent the onset of headaches; and palliative, in which something is done to lessen the distress of the headache episode. All conventional therapies are pharmacological, and they all work only to a certain degree.
So it's a mysterious disease. It affects a great many people, and there are as of this date, no truly effective medical interventions for migraine. The medical interventions that we do have often have terrible side effects.
And what if medication doesn't work? As Dylan's migraines got worse, his parents took him to pediatricians who prescribed Tylenol and said he was too young to take stronger medication. But Dylan continued to suffer terribly, and his parents were distraught.
Eventually we went to a class that they held out at the university where doctors spoke on it, and we stayed afterwards and talked to the doctors and told them, the pediatrician said that he didn't think we needed to do anything about it. And he asked how often he had them. We said, well, it varies. Sometimes 1 a week, sometimes 3 a week. He might go a couple of weeks and not have any, and then have 2 or 3 right in a row. And he said, at any time, if a headache prevents him from being a normal little boy, then it's time to do something about it.
Dylan's parents took him to a neurologist who prescribed medication to treat the migraines, but things only got worse. He continued having 2 or 3 headaches a week, and for the first time in his life had 2 in one day.
And so we went in and they did adjust the medicine. Then that's when he started having some trouble in school. Teachers said they weren't quite sure he was always there. I mean, he was there, but he just kind of sat there and his grades went down. So we took him back in again, and I said, I don't think this is working. I want to take him off the medicine completely.
Since research suggests that stress can be a trigger for migraines, perhaps stress reduction can be a treatment. The neurologist suggested that Dylan try biofeedback, and Mrs. Vargas took him to the behavioral medicine clinic at the Medical College of Ohio at Toledo. The clinic treats migraines as well as other stress-related illnesses, such as irritable bowel syndrome, chronic pain, and hypertension. They use stress reduction techniques, including relaxation exercises and biofeedback.
What's happening physically when you do the relaxation exercises is, number one, the major muscle groups of the body lose tension. The blood flow to the peripheral parts of the body is increased. The sympathetic nervous system, which is that part of the autonomic nervous system that prepares you for emergency reactions, tones down so that your body becomes generally less prepared for emergency fighting or running. And when people learn really good relaxation techniques and learn to regulate their bodily tension, it indirectly prevents that sympathetic nervous system from becoming overexcited, and therefore will prevent the trigger that will cause the ultimate migraine.
Dr. Guillermo Arqueta Bernal, a psychologist, is the director of the Psychiatry Outpatient Clinic at the Behavioral Medicine Clinic.
One of the things that we think is that in almost all kind of stress-related disorders or psychosomatic disorders, for example, one of the things that we find out is that there are a variety of factors that come together. One is perhaps a genetic predisposition. The other factors are things like your lifestyle, your belief system, past learning experiences. It's not that we're saying that there's a one-to-one relationship between stress, for example, and these disorders. We're saying that there's a relationship, but it may not always be necessarily on a one-to-one. So that there are a variety of factors. There are multifactorial kinds of situations that will bring about this problem.
Family history plays a role in 70 to 80% of the people who get migraines. Dylan's father had 2 aunts who suffered with migraines. In terms of stress, his parents admit that Dylan is their most sensitive child, that he always got tense and excited before big events, such as holidays and the start of the school year.
It wasn't necessarily bad stress, just certain, before a holiday when little kids get all excited, his birthday is just around Thanksgiving too. Starting then, he would start, anticipating his birthday or Thanksgiving, and he'd start having headaches. Then again, just before Christmas, he'd get them. Before school, he'd get excited. At the end of summer, he'd start having headaches.
How many headaches, if any, have you had since the last time I saw you?
Dr. Bernal took Dylan's medical and personal history. Then he did a psychophysiological profile. He wanted to measure certain physiological responses when Dylan was placed under a variety of stressors. He was looking for signs that Dylan was especially susceptible to stress. One of the signs of such stress and tension is cold hands.
So we look at what happens to the tension in the muscles of the forehead and neck, for example. What happens to the temperature of the hands? Does that drop? For example, a drop in temperature would mean that person is becoming tense. One of the first questions I ask is, what about his hands? Does he report having cold hands or cold feet? That's a very common feature we've noticed with migraine headache sufferers.
The answer was yes. Dylan's hands did indeed become cold at moments of excitement. This indicated that his autonomic nervous system was aroused.
Well, when a person becomes aroused, there's an increase in heart rate, respiration rate changes, the hands will become cold, you may get a knot in the stomach, the muscles, for example.
Could the process be reversed? Was there a way to reduce the stress and tension and arousal in Dylan's life? Obviously, getting rid of Christmas, birthdays, and other exciting events wasn't realistic. What about training Dylan to relax under stressful conditions? Would that work? Enter biofeedback and relaxation exercises. They were the tools Dr. Bernal would give Dylan to reduce his stress and thereby treat his migraines.
And biofeedback is simply a way of providing individuals with immediate information about ongoing physiological processes that they're usually not consciously aware of. For example, heart rate. That is, we don't know where our heart rate is unless we take our pulse or use a stethoscope to listen to it, or blood pressure, for example, or muscular tension. And in biofeedback, then, what we do is we're able to measure the activity going on, let's say, for example, in a person with headaches.
Dylan can monitor the tension in his forehead and neck muscles by watching his response line. The goal is to keep his response line at or below the standard line drawn across the middle of the screen. He can tell when the temperature in his hands is rising by changes in the sound of the tone. Relaxing diminishes the activity of the sympathetic nervous system, which leads to increased blood flow and a warming of the hands.
Now, one of the easiest ways to think about feedback is thinking about, for example, applying makeup or shaving. When we first start these activities, it is very hard to do a good job if we don't have information. If we don't have a mirror, we don't know how we're doing this. The mirror, in essence, is the simplest form of feedback. By looking in the mirror, I can see that I've left a part of my face, for example, unshaved, or I don't have enough makeup on that part. And the idea then is that the mirror serves as a feedback bit of information.
It feels strange because I don't know how I'm doing it. I just think in my head that my hand's warm, and then all of a sudden it gets warm.
Dylan does his relaxation exercises at home twice a day.
Take a deep breath and slowly exhale.
I listen to the tape he gave me, and it relaxes me.
But what proof is there that relaxation actually reduces the occurrence of migraines? In a recent analysis of numerous studies, Dr. Frank Andrasik compared 2 treatments for migraine, drug therapy and behavioral treatments such as biofeedback and relaxation exercises. The response to this kind of self-regulatory treatment was virtually identical to that of the most widely prescribed drug for migraine, a beta blocker that decreases the activity of the sympathetic nervous system, the same goal of biofeedback and relaxation exercises.
You've only had one headache?
Yeah, on Christmas Eve.
On Christmas Eve?
Yeah.
And how long did that headache last?
About a couple hours.
A couple of hours?
Since Dylan began working with Dr. Bernal 6 months ago, he has had only one migraine. Even people at his school can see a difference in him.
Every teacher there said that he seemed more with it, he was more alive, he smiled, he did talk, which were things that he wasn't doing before. So it seemed like he was a lot happier overall, he had more energy, he didn't fall asleep at home like he did when he was on the medicine, so he was a more normal, average boy.
It is estimated that 1 in 9 American women will get breast cancer at some time in their life.
When I first felt the pain in my breast, I thought I had pulled a pectoral muscle. I was doing a lot of upper body exercises, trying to turn down. And I let it go for a couple of weeks, thinking that was what it was. And then the
Kathleen Morell is 44 years old and works for Columbia Pictures. She lives with her daughter Ariana in Van Nuys, California.
And I went to my gynecologist who checked me out and said, look, you know, you just had a good mammogram 6-8 months ago. Why don't you wait until September and check it out? I think it's just the muscle healing itself. I still was obsessing. I had a doctor tell me I was all right, but I was still obsessing. I went home and I was cranky. And I apologized to Ariana one night. I said, Ariana, you know, I'm really sorry that I've been out of sorts lately, but this pain is bothering me. And she very simply, this 10-year-old looked at me and she said, well, go get a mammogram. And I said, oh, well, I don't think my insurance will cover 2 in a year. And she said, so pay for it. You know, and you'll know tomorrow whether you're okay or not. If you're not, you'll take care of it. This is from a 10-year-old, right? And I'm the wise old mother, right? The next day I made my appointment, and I went in the following day. And I credit her for saving my life.
The diagnosis was breast cancer.
And someone escorted me into a small room, and they flashed at me, I'm going to die of cancer. And it was paralyzing.
The major risk factors for breast cancer are being over 50 years of age, not having a child until after 30, and a family history of breast cancer. Kathleen's mother died of cancer, and she understands that both biological factors and genetics played a role in her breast cancer. But she believes that psychological factors were also involved.
I would say that it probably started about 8 years ago, and with a traumatic event that happened in my life that devastated me. And I didn't cope well with it. I didn't know how to cope with it. It was major. And I started to come back from that, and I think my immune system kicked in and kept it in control during that period, but it was stressful. And just this last year, I did get a divorce. My divorce was final in May, and my cancer was in March. My cancer was discovered in May.
While there's no evidence that emotional trauma can directly cause disease, there are many studies that associate stressful events in life with higher levels of disease.
Let's suppose you have someone who has a high genetic predisposition to develop a certain kind of cancer. And let's suppose that if the immune system is compromised in some way, this cancer might express itself. And let's suppose that psychological stress results in the suppression of the production of certain lymphocytes that are needed to prevent this cancer from expressing itself. One might have a confluence of factors all leading together that lead to the incidence of the disease. Now, no one would want to say, oh, it was the psychological stress that caused the cancer. But I don't think we can so easily conclude that the psychological stress wasn't at least a partial contributor to it.
Currently, a great deal of research is being done to determine what effect our emotions may have upon our physical health. A new field of study is devoted to that investigation, and it's called psychoneuroimmunology, or PNI. PNI studies the interface between the brain, emotions, thinking, feeling, and the immune and endocrine systems, and how those interact and talk to each other.
The immune system is our most basic sense of recognition. It functions to distinguish what is our self from what is not self. So for instance, a virus or a bacteria coming in from outside would be recognized as not self, and our immune defense system would launch its missiles. And there are two kinds of basic missiles that the immune system launches called B and T cells. B cells essentially are a type of lymphocyte that makes a humoral factor, that is a factor that goes into the bloodstream, antibodies that we all know about, and neutralizes viruses, bacteria, parasites through the release of antibodies. T cells function in hand-to-hand combat. The cells actually zip right in there and do battle with a cancer cell or do battle with a bacteria. For years, we used to think that the immune system actually functioned in isolation. And it's peculiar that anyone would think that, because no system of the human body functions in isolation.
I think there was a lot of things that put me in a category that I was a candidate for cancer, but I think that the emotional thing that I went through in this recent period of my life is what triggered the final onset of it.
The immune and nervous systems communicate with one another through neuropeptides.
One of the most amazing links between the immune system and our thoughts and feelings have to do with neuropeptides. These are tiny little proteins, just a couple of amino acids long, that have been discovered over the last 10 years. Endorphins, for example, are neuropeptides, those painkillers that our own brain produces. And now about 60 of these have been identified. And the major site in the brain where they're produced is the limbic system. And the limbic system is the seat of our emotions. We experience joy, anger, sorrow, confidence, all of these feelings, love, through the limbic system. And it turns out that each one of these emotions has a different chemical fingerprint. We experience them. We actually release these various little peptides down into the bloodstream, and they bind to various cells within our body, including the cells of our immune system.
Now that we know that the immune system is affected by neuropeptides, and we understand that psychological stress can have direct effects on such phenomenon as the proliferation of lymphocytes, it becomes scientifically acceptable now to believe what all the grandmothers used to tell us, which is relax or you'll get sick.
Janice Keycolt-Glaser and her husband Ronald Glaser are well-known researchers in the field of psychoneuroimmunology. She is a psychologist and he is the chairman of the Department of Medical Microbiology and Immunology, as well as professor of internal medicine at Ohio State University College of Medicine. Dr. Glaser points out the direct link between stress, the immune system, and disease.
I'll start by saying that anything that the immune response is important in controlling, theoretically, is modulated by psychological stress. And there are three major groups of diseases for which the immune response plays a major role: autoimmune diseases, infectious diseases like colds and virus infections, and cancer. So that one could speculate that anything that would be not good for the immune response wouldn't be good for all three of those classes of diseases.
Doctors Keycolt-Glaser and Glaser began collaborating in the early 1980s.
Jan convinced me that it would be worth trying to design a study to do between the two of us. And so we designed a study to look at our medical students and the impact of academic stress on the immune system to see how it would go.
Blood samples were taken from the medical students a month before final examinations and at the beginning of their examinations. The results surprised the researchers.
In summation, all the studies have told us so far that the immune system, particularly the cellular immune system, can be modulated by academic stress, by psychological stress. And it can be modulated at many different levels. And so what we're doing now is to explore these interactions to try and learn how these systems, the body systems, are interacting with each other to ultimately wind up with a depression in the immune response.
Other studies have found suppression of the immune system in several populations experiencing various psychological stressors. Among them, people who were separated, divorced, or experiencing marital discord, bereaved spouses, and students who reported being lonely.
The med student studies told us that even a really commonplace, a real simple everyday stressor could alter immune function. So we wondered, what if you had a very chronic, a very long-term stress, something that goes on for years at a time? What would happen actually to immune function?
The Glazers are in the 4th year of a 5-year study of the caregivers of Alzheimer patients.
With caregivers of Alzheimer's victims, you have a really severe, really long-term chronic stress. In some ways, it's analogous to the bereavement work in that some caregivers call the process one of continual bereavement as they watch parts of someone they know and love dying. To study caregivers, we reasoned that we would look at not only caregivers but then controls, people who are the same age, the same sex, but who don't have any caregiving responsibilities. So we'd know if it were simply the caregiving responsibilities versus the absence of them. And we found that over the course of several years in studying our caregivers, from the first to the second year in the study, immune function declined, particularly in spouses who were caregiving for a spouse, who tended to be older and tended to be providing more extensive care.
What makes this study noteworthy is that the caregivers were ill more days than the control subjects. The researchers, with the subjects' permission, contacted their physicians to validate this data.
We find that there's really excellent correspondence, that when caregivers report certain symptoms, we have a good match with physician records for infectious illness. So it gives us some of the very first data that suggests that people who are under very chronic stress, who show declines in immune function, actually have a greater health risk.
So research does show that stress may contribute to increased illness. Yet experts advise caution when trying to draw cause and effect relationships between psychological factors and such diseases as cancer.
I do get a little concerned about people who take what little scientific evidence is there, and then they take that an order of magnitude or two and run with that and propose that this has major implications for how patients should be managed, particularly cancer patients. I think they're out there a little too soon. I think they have to wait for the scientific evidence to be generated to answer that question.
We don't know yet what these immune changes actually mean, by and large, for real health outcomes, and especially for really serious illness. I think we have good preliminary evidence at this point that there may be increased risk for infectious illness. But when you talk about what this means, for example, for someone who has cancer, you need to tread cautiously. Certainly, I think that we know the way you think and feel can affect your immune system, but that may not be such a large effect that will actually influence the outcome of an illness.
Recent books and articles have made dramatic claims about the causes of and cures for cancer.
I get concerned about the people who say that you should be able to stop your cancer or stop progression of your cancer, and that if you don't in some way you should feel guilty. Because we know that certainly that having cancer is already a significant burden. I don't think there's any evidence you're at fault if you have cancer. And if you can't stop the progression of your cancer, that has nothing to do with your being a good or a bad person. And many of the less conventional therapists might suggest that that's the case. And that's a real matter for concern.
Even cautious scientists agree that our minds and bodies influence each other. What they are only beginning to understand is how they do it and how much. Given what is known, however, Kathleen Morell feels it makes sense to battle her cancer with both her body and her mind. She had a mastectomy, underwent a course of chemotherapy, and recently had breast reconstruction. But she also engaged in some psychological therapy.
I had complete confidence that what they were doing was right. My medical treatment was right, but there was other stuff I needed. My body was being taken care of, but I needed my mind taken care of, because it's scary.
Dr. Robert Hoffman is a psychiatrist at the breast center where Kathleen is a patient. The philosophy of the center is to treat each patient as a whole person.
What we tend to try to do is help people to understand the basic ingredients that seem to correlate with better quality of life and even improved survival. And those seem to be emotional support, psychological support, and taking care, that's part of taking care of the spiritual needs of a human being as well as the physical or biological needs. So there's a variety of approaches that help people not only to manage stress, but also to nurture their spirits. Some people can get psychological support from participating in a group of cancer patients who share their experiences with each other.
Leon Schill-Cody, a registered nurse with a master's degree in psychiatric nursing, runs the group that Kathleen is in.
My goal is May 30th will be my 1-year anniversary of finding the breast cancer at the breast center. And when I walk into the breast center on May 30th of this year, ladies, I'm going to have hair. It's going to be colored. It's going to be cut. And I'm going to have 2 breasts that match pretty well because I'm going to lose that weight and I'm going to be looking good for 91. That's it.
Maybe this idea of support isn't just making the patient feel better and dealing with their day-to-day operations better. Maybe this is really impacting physiologically. And that's what I believe, and that's what I've seen with my women.
They're growing up now, and there's this part of me still that has a hard time sharing cancer with them, and I sort of want to protect them, but I feel now that they're getting a little bit older. They're 15 and 13 now.
Oh,
they're okay, and so we talk a little bit more about it, and my fears of am I going to be okay, is, you know, and I still feel things and immediately just panic.
I think we've all been through that. When I do get depressed, though, I go in and I listen to my tapes, the meditation. They've done wonders for me. I don't know what I would have been able to, or how I've been able to handle the fear of reoccurring cancer.
I didn't feel very good, and I think when you don't feel good, your thoughts, you know, you think more. You know what I'm trying to say?
Yeah. I don't know about anybody else, but I don't know if it was flu and the chemo, because usually I get kind of chilled anyway, but it was so bad this time was that I had sweats on. I had another ski cap I have that I wear over my head at night, and I had wool slippers on, and I was under the blankets and still freezing.
We don't want to be making claims that we can't support, but the mind-body connection is absolutely there. It's there every instant. When the mind thinks, the body listens. So whatever goes through the mind, the body hears it, and you can just work with that.
2 recent studies suggest that psychological support may actually have biological consequences. Sandra Levy and her associates at the Pittsburgh Cancer Institute have studied the effects of social support, fatigue, and depression on the immune system, especially natural killer cell activity, in women with breast cancer. Natural killer cells play a surveillance role in curbing malignant cell spread. In general terms, Levy found that women who felt they had lots of social support had greater levels of natural killer cell activity than those who did not. At Stanford University, Dr. David Spiegel studied a group of women with metastatic breast cancer. They were divided into 2 groups. One group received medical care, plus a year of weekly supportive group therapy with self-hypnosis for pain. The control group received standard medical care only. The general finding was that patients who received group therapy survived an average of 36.5 months from the onset of intervention. The control group, an average of almost 19 months. In other words, the treatment group lived twice as long.
I think that's a remarkable finding, and I'm delighted that this finding is here. I'd like to see it replicated. I'd like to make sure that it's firm. And if it is replicated, and if it is a firm finding, well, then I think psychologists have an awful lot of work to do to discover just what the critical ingredient is in the psychotherapeutic intervention that prevents the relapse. And it may very well be that the psychotherapeutic intervention is a sufficient stress reducer so that the immune system functions more effectively than it would under chronic stress.
While experts agree that further research is necessary, Kathleen Morell is convinced that her mind can play an active role in her recovery.
If stress can make you sick, that your mind is also capable of convincing your body to get well.
In addition to her ongoing medical care, Kathleen does relaxation exercises. She also practices guided imagery, where she visualizes the cancer cells within her being destroyed by her immune system. Though there is no scientific evidence that this exercise actually destroys cancer cells, it does give Kathleen a sense of having some control over her disease.
It is probably the case that if a patient like Kathleen Morell believes that what she's doing is going to prevent her from relapsing, she should certainly continue doing it. Her peace of mind may be a very important tool in fighting a relapse or preventing a relapse. And now, what I said before was that if you have the genetic predisposition, and if you're exposed to the toxic environment, and if all the factors are correct, and on top of that your immune system is compromised by stress, it may contribute to the development of the disease. By the same token then, if your immune system is not going to be compromised by stress, because you're learning how to manage your stress and control your stress, it may give you a little bit of an advantage in preventing a relapse of the cancer or in helping to suppress the cancer.
And my biggest fear, of course, is recurrence or death. But if I'm living my life and not in the future worrying about that, which gets easier each day, it really does. There's a lot less thought process about it than there was when I first was diagnosed. Then I'm going to have a good life, no matter when it ends. I'm not going to have to, you get a choice. You can plan your funeral or you can enjoy your life. And I chose the positive.
For Dylan Vargas, Frank Pink, and Kathleen Morell, people whose physical ailments are vastly different, there seem to be at least two common elements. They believe that stressful events of one kind or another have played a role in the onset of their illnesses. And they believe that stress reduction, in the form of biofeedback or relaxation exercises, can help them. For these three people, at least, the result seems to be an increased calmness, self-confidence, empowerment, and a lessening of symptoms. For the rest of us, it's an ongoing question. Increasingly, researchers are trying to discover the exact dimensions of the role our emotions and other psychological factors play in our physical illness and physical well-being.
Funding for this program was provided by the Annenberg CPB Project.
To learn more about the Annenberg CPB Channel series and workshops for teachers, how to take them for credit, how to buy them on video cassette, call 1-800-LEARNER and visit us at www.learner.org/channel. The Annenberg CPB Channel.